Good evening and welcome to yet another exciting edition of Healthy Living on NCDOH TV. I'm Malik Kal, the man of the Midas touch, and your host. And thank you so much for making us part of your family by simply doing the simplest thing, liking our Facebook pages and our social media platforms, commenting, asking questions. And we do appreciate those questions as well as we come back to you with the proper answers and encourage your community members, family, and friends to do the same. Right now, we're talking about a matter that, sometimes you have a headache, you don't know why. You delay also to get medical help at a clinic so that you are referred to a more higher facility so that you can get the help you need as soon as possible. We are talking about neurosurgery, and we are sitting with Dr. Queen Ramoraswi, who is in the studio now, and we're going to talk about what is it about their department actually, so that we have a further understanding, so that one day when you're called in and you go to Robert Mangaliso Sobukwe Hospital in Kimberley or anywhere else in the country, you understand what the department is all about. And obviously the medical doctors or the medical officers there will be explaining to you as a patient what procedure they will be undertaking on you. Doctor, thank you so much for coming through and joining the show.
Thank you so much for having me, Malik.
Now, in a nutshell, when we talk about neurosurgery, what are we talking about?
Thank you so much for the opportunity and good evening to the audience at home. So in a nutshell, if I have to describe or explain what is neurosurgery to someone who's never heard of this before, because it's a niche on its own. A lot of people, when you are sick, you go to a GP, that's what we know. But when it comes to neurosurgery, it's a very specialized unit. Mostly you find it in tertiary hospitals. Robert Mangaliso Sobukwe, we are the only neurosurgery department in the whole province. And what we do, basically, we deal with conditions that has to do with the brain, the spine, and the peripheral nerves. When I say peripheral nerves, I mean the nerves in the body. So that's our bread and butter. So if you're referred to neurosurgery versus neurology, which is a confusion that most people have, just to clarify so that people understand at a basic level. So neuro, meaning that it has to do with the neurological system, like your brain, your spine, your nerves. And then there's an element of surgery where a neurosurgeon or someone who works in neurosurgery operates on the brain, the spine, and the peripheral nerves, if I have to put it in simple terms. And then versus neurology, where it's a medical doctor, the patient has some kind of neurological problem, but it's not for surgery. They manage it medically.
All right.
Yeah.
So that person will basically just get treatment rather than being cut open and correctively so.
That's correct.
All right.
Yeah.
So what kind of patients do you guys see and what would be the referral pathway? Because you had mentioned earlier that Robert Mangaliso is the only tertiary hospital number one. Then we have that department in the whole province. What would then be the referral pathway and what type of patients do you see?
So, currently in the province of the Northern Cape, I mean, you can see the coverage of the population that we cover. So, any patient, as I said, it's in tertiary hospital, meaning that you need a referral letter. So you can't leave home and come to Robert Mangaliso and demand to see a neurosurgeon. It does not work that way. No, it does not work that way. But however, we work with the districts and the clinic. So you will be seen by a health professional or a medical doctor at your district hospital, and then they will assess you and deem it necessary for you to be seen by a neurosurgeon. Then you'll come via the referral pathways. So the type of patients that we see, as from the description that I gave you, what we do. So we would see patients that have conditions that has to do with the brain, the spine. So most of the time, as I said, it's more of medical things like your brain tumors, your spinal tumors, and then it's also trauma things. When still on the side of medical, also our mothers, our grandparents, they take high blood medication. Nowadays, even young people have high blood medication. And if it's out of, it's not well controlled, they can bleed into the brain. If they do bleed into the brain, then we are the people to call. And then also we do trauma, a lot of trauma. Our bread and butter is a lot of trauma. I mean, we're in the Northern Cape. If you can see where the Northern Cape is located, it's between two big cities, Cape Town and Johannesburg. So people always pass here so we have accidents and we get a lot of neurotrauma patients. And when I say neurotrauma, I mean the brain, the spine. So yeah, we also see kids as well. So we cover everything from childhood up to our grannies, So we do see kids as well for congenital anomalies that I will allude to shortly.
Yeah. Now, in the context of the Northern Cape, what are the common conditions that you guys are seeing at neurosurgery?
So basically, our bread and butter is, as I said, it's mostly neurotrauma.
Mm-hmm.
So neurotrauma has to do with a healthy patient who was yesterday jogging the other day, and then they get involved in a motor vehicle accidents. And as you know, the young ones will continue to educate because alcohol is an issue. They assault each other. The first thing that they hit is what they hate, because they call it knock it out. They knock you out. So most of the time, we get a lot of neurotrauma. Be it brain, be it spine, from anything from fractures to bleeds into the brain, fractures of the spine, and so those are our bread and butter. When it comes to the opposite side of the things that we see commonly in children, which I think is very paramount to speak about, especially in the Northern Cape, for more health education purposes, is meningomyelocele. People know it as spina bifida. I'll explain what that means, but in kids, that's what we see commonly, and I think it's an area that we can look into in terms of prevention.
No, what is that?
So, I know.
There's a word there.
People may have never heard about this before, but I think if I have to explain it in a way that someone who doesn't have a medical background understand, because I think it's important that we communicate it in a way that patients understand, because at the end of the day, it's what affects them. They need to know how to access the help that they need, should they need help. So meningomyelocele, people might know it as spina bifida. I'm sure some people might have heard it on TV or on radio or something along those lines. So it's a congenital meaning that it happens during the development of the baby, intrauterine, in the mommy's tummy. So normally, if I have to describe it to the basic level, is that, I hope this is not censored information, but we know biology, the egg meets the sperm, then it's a baby, then it will form like a ball. So that ball is what is going to develop into meat and meat. So what happens is that how the brain and the spine forms, it starts as a plate like this. That needs to close like this. So closure is through your back. That's why there's a line at the back, you see. So usually what happens is that when it does close, it's like a zip. It zips from the top, from your head, and it zips from down. Then it must meet, and then it closes. But that process sometimes, when the baby is still in the mommy's tummy, does not happen properly, to a point that the spine now is just sitting on the outside of the child's spine. So that is what we call spina bifida. It can be open, sometimes it's closed with skin, but I think that's terminology for us to worry about. And I think of utmost importance is that it's something that happens while the baby's still inside. Once the baby is born, there's very limited things we can do, but there are some things that we can do.
Wow. Yeah. Now, earlier on you talk about traumatic brain injury. What would be considered as a traumatic brain injury?
So trauma, we all know what is trauma. So traumatic meaning trauma. There was some kind of external force from somewhere, be it from an accident, be it from an assault with a beer bottle. Nowadays, we see gates falling on children, and even kids do get traumatic brain injuries. And as I said, pedestrian vehicle accident, that's one of the top things that feeds into our traumatic brain injury patients cohort. And also, like traumatic brain injury, it's like there was some kind of trauma to the brain, because the brain is very sensitive. Your personality, how I speak, how I engage, how you think, your intellectual, your ability to think and be independent in all areas of life, it's all in the brain. So if there's some kind of trauma to the brain is not so forgiving like other parts of the body. So if you do get some external force to your head, then what happens is that you might end up with either fracturing the skull, which is a very tough bone, but we've seen it can get fractured, and then you can also injure the brain itself.
As they say, you got a thick skull.
Exactly. But a delicate brain.
Yeah, but in that way, it's a form of an insult.
Yes.
You got a thick skull.
You got a thick skull, but a very delicate brain.
But medically you do.
Medically you do, but the brain is very delicate.
Yeah.
Very, very delicate, yes.
Yeah. So what can we do? Is there, as communities, lifestyle changes, so that we don't find ourselves in these predicaments of injuring ourselves, particularly the brain and the spine, which for me, very, very sensitive and very, 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 we need to be very careful with them. So what do we do then to make sure that at least we minimize the risks?
I like the fact that you did say sensitive, because for me as a doctor that works, I mean, it's my bread and butter, that's what I do. I think it's very sensitive. Hence, I emphasize on the fact that the brain is very delicate. So you have a thick skull, but you have a very delicate brain.
Oh, yeah.
You have a very delicate brain, because once you damage that brain, your life changes forever. And not only your life, but actually the life of others and everyone around you. So I think what people can do to sort of, protect this delicate brain is basic things. I mean, the Department of Transport have always had campaigns where they talk about drinking and driving. They've had campaigns when they talk about alcohol. I mean, in the Northern Cape, we know alcohol is a big issue. So I think the main thing that we need to communicate to the community is that you need to be responsible. Safety first. Prevention is always better than cure, because sometimes when that brain is damaged to a point of we cannot repair it, then we've lost a lot. But if we're able to protect it, from even getting the insult in the first place. So I think things like safety, like if you're gonna drink, please drink at home, because there at the taverns, people that come to taverns, not all of them are there to drink and have a good time. Some of them are there, to get make a living. They will rob you and knock your head with a beer bottle, and then next thing it's either, if you don't demise on the scene, you'll end up in our unit. So I think for traumatic brain injury specifically, I would encourage the community to make sure the gates, I will emphasize the gates issue, because we've been having a lot of this gates. Those railing gates that we have. Kids, when they see you coming, they run to the gate and they open the gate. Then it falls off the rail, it ends on the child's head. So that will be one of the things that we need to make sure that kids are always supervised when it comes to that. The other thing is that when you drive, most of us have cars. We have children that we drive with. Put on your seatbelt. It's basic things. Even the kids, I've seen adults where the mom and the dad would have a seatbelt, and then the kids at the back, they're even standing in between the mom and looking at the back window, because as much as we understand this thing of trauma, when a car is moving at a specific speed and then it comes to a sudden stop, your body goes forward in the same speed. So if you're driving 120 hours, that little body goes forward at 120 kilometers per hour. And what happens? The brain is the first thing that, because I said, it's very delicate. So as I said, drinking and driving as well. If we're going to drink, do it responsibly and make sure that you're safe. And also, as I said, for the kids and also bikers, put on your helmet if you can. I mean, it's not completely going to protect you because your body's still exposed, but at least it can protect your brain from such an impact. And also, I mean, in that way, if you put on a seatbelt, you might also protect your spine as well.
So how do then mothers prevent or take precaution for spinal fibula?
So I think this one is a very important and a very interesting one, I must say.
I'm actually intrigued.
Yes, it's very
I had to go back there.
Yeah, it's very interesting because it's one thing where we know that the prevention works. So you know how any woman of reproductive age, I think it's important that we emphasize education is always the best, because some people don't know. If you're not in the medical fraternity, you won't know the basic things. So if you're any woman of childbearing age who is sexually active, not trying to have a baby, because sometimes we have oopsies all the time. Some kids you did not plan, but then you find out after you miss your first period that you are actually pregnant. And unfortunately, when it comes to spina bifida or meningomyelocele, that's a bit too late, because that process takes place before the closure takes place before you even miss your first period. So I would like to urge and ask mothers, because it's a problem in the Northern Cape, to please. There's a vitamin that you can take. It's a vitamin. So it's not for pregnant women, because some people associate certain medication to, my pregnancy pill. But there's a vitamin called folic acid that helps with the closure of that spinal cord.
So we all know that when you say, I'm pregnant, you go to the doctor, give you folic acid.
I know. It's too late. Unfortunately, it's too late. If that closure did not take place, then unfortunately, there's not much that we can reverse. But I think I would urge women of all reproductive age, please be on your folic acid. It's like 20 rand, I think, at the pharmacy.
You know what? This is a revelation.
Yeah.
Because I do not think that there's any woman out there that is not pregnant there is taking folic acid.
There we go.
I really don't think so, because folic acid is equivalent to pregnancy to many of our community members. So guys, go get folic acid. Drink it.
Please, let's save the kids.
Please.
Because the complications are very devastating,
But what are the long-term effects of
So, yeah, it's very sad, I must say. Because, I mean, every woman that's pregnant, or every couple or every family that's pregnant, you hope to have a normal, abled child when it comes to physical abilities, like able to walk, able to self-care, able to do all of these things. So it's a very devastating situation when a mother, let's say, I'm going to give an example as from Kuruman. I'm not saying it's happening in Kuruman, but I'm just going to give an example. You give birth and you see your child in that condition. You see like something there, you don't know what's going on. And I think most of the time, the education is not passed through, to mothers to actually explain to them how did that come about. But the complication of that is that most of these kids, remember the spinal cord controls the lower part of your body, like your movement, feeling, your ability to say, well, I'm stepping on a stone, well, it's hot, let me move my leg. The sensation, there's a whole communication that I'm not going to go into.
There's a network. There's a network.
That's all network. That's all you need to know. There's a network from the brain to your, the rest of your body. So now if there's a second that's running from the brain to your leg, and then you break it up there on the spinal cord where you have this lump or the spinal cord that's not normally formed, what happens? Then you lose power. It means that anything from that point, that is the worst case scenario. The kids are born disabled, I would say. They will have to be wheelchair bound for the rest of their life. And they're very intelligent, normal kids. So you can understand how devastating that could be for the parents, for the family, and for the child as well. Because any child wants to be normal, wants to run around. When they're sitting there in a chair, seeing other 18 months old running around, it's frustrating. It's a whole new adjustment. And I think if mothers are able to understand that, what they can do to prevent meningomyelocele spinal bifida, it will go a really, really long way.
And I think it's also important for pregnant mothers that didn't drink folic acid before they were pregnant to attend the antenatal clinics, so that something, if it's detected early enough, there's also a mental and emotional preparation that you could get a child like this. Because sometimes our mothers would give birth, especially within rural areas of the Northern Cape, give birth at home, see the child is like this, and the next thing what do they do? The child is found somewhere in a drain or in a dustbin or something, because they can't deal with that and say, you know what, I don't want the child, because they were not properly prepared.
Exactly. So it is. That's what I'm saying. I'm very sensitive when it comes to things because I'm a mother myself. So I do understand that when you're pregnant, the hope and the vision that you have is that you're going to give birth to a normal child. But when you have a child that's differently able or looks different, and you can see that, because sometimes that same spinal bifida can grow and people can see that, no, why does it look like your child has like a lump on the back, So it's quite devastating. And I think if mothers are empowered, especially in the Northern Cape or even everywhere in the world, to actually, take charge of their health and their reproductive health, because we do have amazing antenatal care services, but start your folic acid. If you're sexually active, be on folic acid.
Yeah. And, well, if you don't want a child, use protection.
Please. That too. We always encourage well protection.
Yeah.
That too.
So is there any corrective surgery that would happen if a child is born that way and it's not a severe condition?
Yeah. So it's always a decision that we need to make based on our clinical, assessment and what we think is best for that specific child. So it's not a one shoe fits all. That mothers must have an impression that, neurosurgeons can fix this, my child can walk again. Unfortunately, as I said, once you have a child who has this, there's very little that you can reverse. Because you do get kids who have this, but they're still able to walk, depending on how, at the micro level, that spinal cord is formed. You do get kids that are able to walk. Some mom might be listening to me and saying, my child has that, but my child is walking. So as I said, there's a whole grading way. The worst case scenario is those children that are on nappy for the rest of their lives, But I think the most important thing is that parents need to understand that we are here. We do have a neurosurgery department here. And I think most of the doctors in the periphery, they're good at picking this up. because most women, even if they give birth at home, they always end up at the CHC, because you need to get that road to health book. You need to get your child checked out. You need to get yourself checked out. So we never have a problem with getting them to us. So if we do get them to us, as I said, when we do the operation, most of the time it's like cosmetic for children that already the spinal cord is damaged. But as I said, it can either be closed, it can either be open. If it's open, meaning that there's a whole communication of the whole environment with your spinal cord in your brain, because it's one we said network. It's one network. It's one network. So if there's a whole, like an open spine where things can go in and then the child can end up with infections, you can close that defect. But in terms of the neurological functioning of the child, we cannot always say to you that your child is going to be normal. Sometimes we do operate, the child is still the same. It might frustrate patients, or the mothers themselves.
Yeah.
But at the end of the day, I think they need to understand that there are things that we can do. Not all one shoe fits all. We take it case by case. And sometimes we don't operate. Sometimes we do need to operate to prevent this risk of getting infections. And if we do operate, unfortunately, it's not always that, like, we can say to you, well, your child is going to walk after the surgery. It all depends. Yeah. Some kids, if they've been walking, they'll still continue to walk after the surgery, Yeah. And some kids that have not been walking will still not walk, So as I said, prevention. I cannot emphasize that more.
And thank you for saying prevention. In closing, quickly, top five things that people should know about neurosurgery that they can live with in their daily life.
Yeah. So neurosurgery is here. You do have the services. We are here, ready to work, So the 5 things that I would want people to know about neurosurgery is that neurosurgery prevention is always better than cure. So we do exist because we know that most of the time we find ourselves at the end of when we pass the prevention, phase of preventing your traumatic brain injury or MNCs. So prevention is always better than cure if we can, We hear if it happens, by all means, they should refer to us. The second thing that they need to know about neurosurgery is that it's not like the end of the world. People, when they think about neurosurgery, they think about, there's no hope. Even health professionals. We are not the favorite departments because, as I said, people have the idea that, our patients are always in their worst case, because, as I said, the brain is delicate. Once you damage it, there's the possibility that you might not be the same person, that you can't take care of yourself, and that sort of a thing. The one thing that I want people to know is that the discipline exists, and there's a lot of patients that if we have to put them here and show you before and after, you can see that we are making a difference. So it is a discipline for me with the greatest utility, because you get your young patients, healthy patients, that's 80% of your patients. Mm-hmm. And if you're able to assist them to a point where they can walk out of the hospital, it's always a good thing, And the third thing that people need to know, as I said, when it comes to spinal bifida, I don't know how many times am I going to sing this song. Folic acid equals spine protection. So take your folic acid to prevent all of this, like the spinal problems that we see in kids.
Sure.
And the other thing is that when it comes to neurosurgeries, the services are available, and you always emphasize that the health is in the patient's hand. If you think there is a problem, go consult your clinic. Your clinic doctors will assess, and if there is any need that you need some kind of brain surgery or anything, the services are available. You will be referred appropriately to the center. And as I said, the brain is delicate. Please take care of yourself. Safety, and safety.
Yeah.
So do all those things.
Do all those things.
I mean, Department of Road Safety, and they'll be good at advocating and passing that message to the population. Yeah. So safety first.
Raf is running out of money.
Yes.
Yes. Yeah. So, a backache is not just a backache. Check it out at your local clinic. A headache is not just a headache. Check it out at your local clinic. You're feeling some sort of like a pinched nerve in your back somewhere here. Go check it out. It could be more serious than you think. Stop going to pharmacies and prescribing your own medication, painkillers, and so that you can have some sort of temporary relief on the headache or whatever. check it out. It could be worse than you think. Remember, that is your responsibility so that you do not end up on a table being opened up and trying to fix the damage that you've caused. Yeah,
I like that you said that, because that's what we do. We also the back doctors for information purposes.
So
for all those back pains.
Yeah,
yes,
I
come to us.
I normally say to communities that a surgeon is like a car mechanic on steroids. So when you're not changing your oil properly or checking your water in the car or whatever that might do with an engine, that engine is going to give you problems at some point. Now you need to go to a mechanic to try and fix it. Whether they can fix it or not, and that engine might not be the same after that. So a human body is much more complicated than an engine. So there's a network. So imagine you're walking into a computer server and there's all these cables running, and just your electric box, when you open it and you see all these wires coming up and down, equivalent to that. Now, there's a lot of them. You can't keep track of all of them. So eat healthy, exercise, be careful, reduce the amount of alcohol that you drink, stop smoking, be healthy. Exercising does not mean you must join a gym. All it means is that you must be active, even if you're jumping up and down in your living room for 10 minutes or running around your own house for 15 minutes. It's a physical activity. It's cardiovascular exercising. You can do push-ups. You can eat healthy, plant in your yard, go to a municipality or the Department of Agriculture, or if you can afford, a lot of shopping complexes have a place where they will be selling vegetable seeds. Plant and eat vegetables, eat healthy, which is the food that you would grow yourself, which would be cheaper as well. So let's exercise, let's look after ourselves. Doctor, thank you so much for coming.
Thank you so much for having me.
And when I'm sure a lot of people, when they see you now, it's fine mechanic. They're like, yes, fine mechanic.
That's why we care. It's okay.
Yeah, thank you so much, Doctor. That's Dr. Queen Ramorasui, who is from neurosurgery, and we've learned a lot. Folic acid is important, ladies. When you start having sex, start drinking or taking folic acid, and of course, use condoms because you never can trust your other partner. All right, so Amalika, thank you so much for joining us on this exciting episode. What a lovely chat we just had with neurosurgery, Dr. Ramorasui. I'm going to get it right one day.
Yeah, I'll give you time.
I'm going to get it right. And of course, keep on joining us next week at 7 o'clock on Wednesday on NCDOH TV. This is Healthy Living. Don't forget to also watch our other episodes. We have Did You Know It's on Mondays. On Tuesdays, we have a radio show on NCDOH Radio. Wednesdays is Healthy Living. On Thursday, we've got an exercising program with our coach. We call him Coach. Watch it from 6 a.m. While you're still at home preparing for work, you can put your phone there and emulate and follow Coach and exercise as an effort from the Department of Health to try and get you moving. Healthy Living is obviously on Wednesday, and then Coach is on Thursday. And then on Friday, we recap everything that has happened through the week within our province of the Northern Cape. Thank you so much for watching. Let's meet each other once again on Wednesday. Remember, the very best amongst people are those who benefit mankind. Good night.